Okay, we chose to do our presentation on the global impact of neurological disorders. We're focusing on low-income countries, particularly Afghanistan. The problem: in 2015, neurological disorders, classifying stroke as a neurological disorder rather than a cardiovascular disease, ranked as the leading cause group of DALYs and the second leading cause group of deaths in the world. It is a growing problem, with the number of deaths attributable to that cause having increased 36.7% and the number of DALYs by 7.4% between 1990 and 2015. The highest DALY rates for neurological diseases were found in Afghanistan, Central African Republic, Guinea-Bissau, Kiribati, Somalia, and the highest death rates from these causes in Afghanistan and the Central African Republic. It is estimated that the prevalence of people living with neurological disorders will continue to grow in the coming years, and that means the need for clinicians and facilities that can provide needed treatment, a need that is currently undermet, will continue to grow. Afghanistan is right between Pakistan and Turkmenistan, Tajikistan, and Iran. And they have a relatively new government. Their constitution was just adopted in 2004, and the period of war right before then completely destroyed the infrastructure of medical care, health care in Afghanistan. And so right now they are building from scratch. There are a lot of challenges that they face in Afghanistan. There are only 6,000 physicians and 14,000 nurses for a population of 28 million people. They have poor roads, and most people lack vehicles. Most of the people in Afghanistan don't have personal automobiles. Most transportation is by truck or bus with people piled and stacked inside, and yet they have the issue of men and women not being able to travel in the same part of the transport. So transportation is very difficult. They also have a lack of security, with many threats of danger to life and limb. More than 50 healthcare workers or healthcare centers have been closed due to violence. And Islamic law requires that women only be treated by female doctors, but during the Taliban rule from 1996 to 2001, girls were not allowed to attend school. So there's a severe shortage of female doctors. While the government has identified a package of basic health services that everyone's entitled to, they really have not made health care a budgetary priority. And so most of the health services that are provided in Afghanistan are provided with outside money. They're provided by non-government organizations and religious charities, and they're funded either by other countries or by charitable organizations. Nearly 70% of the people in the country live in extreme poverty, and there's 32% unemployment. And so people really cannot afford to pay for health care, even if they very much need it. The United States is offering help through results-based financing. They offer those non-government organizations grants that they can earn if they are making a significant difference. Their top priority is maternal and child health, and so they really aren't focusing on neurological disorders. That's where help is needed in Afghanistan. They have made a difference with providing more female doctors for Afghanistan. And so what the United States assistance has done can't be underestimated. It's just not addressing the specific problem of neurological disorders. The government of Afghanistan has actually identified mental health as a crucial area for health care. They just right now aren't able to meet the needs in that area.
So how do neurological diseases affect the Afghanistan population? So a lot of it is that they don't have the proper education. They don't have the necessary resources to get the education that they need about these neurological disorders. And so one of our big thing is wanting to educate more of the family members and the clinicians and everyone around taking care of these neurological disorders, because there's just not enough information and they're not able to treat it right because they don't know. The hard thing with neurological diseases are there is a lot of different symptoms and signs associated with each disease. So that's one of the problems that we need to tackle, is just getting the word out there about these are the signs and symptoms that you need to look for, and these are how you would treat those. And if you start seeing these symptoms, it's important to get in and get more testing before it becomes a major problem. Currently, it is a major cause of disability for people under the age of 65 in Afghanistan. This is because, unfortunately, neurological diseases aren't curable. Once you get them, it's a lifelong disability, and you have to kind of learn how to deal with the signs and symptoms and adapt to that lifestyle and change the way you think and how you do day-to-day business because of the different symptoms. Unfortunately, in Afghanistan, there is a lot of PTSD and cases like that. So a lot of the neurological disorders or diseases and disorders are actually mistaken for psychological diseases, such as PTSD and other things that come from that, which unfortunately they just look at it as they've been through a tragedy in their life, and they're not wanting to address the problem, but instead just kind of cover it up with that diagnosis. Currently, there's not enough facilities for neurological disorders. There's just not enough doctors and nurses to take care of these different people that have needs because the shortage, and they're looking towards more of the curable diseases than dealing with these neurological diseases. So the epidemiological measurement, so like I said, most of them are attributed to conflict and post-conflict, which happens because there is a lot of war going on in Afghanistan, and a lot of these children and adults are exposed to it early on in their life, and that's becoming a problem because it's not starting to show up until they get older, and then by that point, it's kind of a lost cause. It's a really high total burden of disease for Afghanistan. I mean, the statistics are crazy that they don't look into it more and see what they could do. Due to a high combination of high prevalence, early onset, persistence, and disability is attributed to conflict and post-conflict settings. It's sad that because there is so much going on that they won't look into it more and try and find a cure, but instead just kind of cover it up.
Okay, so there are going to be two organizations that are involved with neurological disorders or diseases. One very prominent one is the World Federation of Neurology, and the mission of the WFN as a UK registered charity is to foster quality neurology and brain health worldwide, a goal we seek to achieve by promoting global neurological education and training with the emphasis placed firmly on under-resourced parts of the world. So the WFN really focuses on education, training, and awareness of these disorders and diseases. They don't necessarily focus on the distribution of it and having facilities for these types of, I guess you can say, like they don't have like hospitals and stuff to do these types of things in. But what we really like about this organization is that part of being able to determine neurological disorders and diseases. The next organization that is involved with neurological disorders is, I'm going to go to the next slide, is the American Brain Foundation. And their mission is to bring researchers and donors together to benefit brain disease. The American Brain Foundation is a central driving force behind bringing all neurologists, researchers, patients, and caregivers together to help generate funding for an awareness of brain disease. So the mission of them clearly is to kind of bring everybody together, everyone that's needed in order to bring awareness and educate the public about brain disease and neurological disorders. The one thing that they do lack, again, is that there is no distribution part. So that's where our idea comes in, is that we want to focus heavily on the distribution part and getting those people into facilities or such things like that. And yeah, go ahead.
So we're looking at where there are gaps. The Afghan National Security Force, which is made up of the Army and the police of Afghanistan, provide most of the tertiary care in the country. That is care for very serious diseases, but there are many parts of Afghanistan where primary care just isn't available. There are no clinics, there aren't enough doctors, there aren't enough nurses, there's not enough equipment. And about 70% of the medical programs there are implemented by outside charitable organizations. Right now, the facilities that have been built close to large cities where there's infrastructure. Those are provided mostly by non-governmental organizations, and we actually seek to become one of those non-governmental organizations and provide some support. Transportation is a very serious problem. There are not good roads in Afghanistan, and most transportation is either by bus or by truck. And when they try to travel to a facility, men and women have to travel either in separate buses or in separate parts of the bus. And they lack the money to pay for transportation. And so our idea is that we will take the services to the people. Clearly, transportation is a problem. This is what the roads look like. And so what we'd like to do is have mobile units that would serve quite a large area on a rotating basis. They would spend a few days in one area and then travel on to a nearby area and have a circuitous route. And so we still have some questions that we need to answer. Basically, the important thing is that we need the equipment to take the treatment, take the service to the people. We need diagnostic equipment, and we need people qualified to diagnose the conditions. And we need to make sure that we have both male and female providers in the right proportion so that women can be seen by female providers. So you'll see the resources that we used on this page. Is this the last page, or do we have another resource on the next page? I think that was the last. Okay. So those are the resources that we used for our research. Thank you.
Thank you.